Would you really trust your memory, your focus, and even your intelligence to a medication no one ever warned you could destroy all of that? Well, that's exactly what's happening to millions of people every single day. And here's the craziest part. We're not talking about rare or banned drugs. We're talking about the most common medications, the very ones you might have sitting in your cabinet right now. And the worst part? Most people only realize the damage when the signs are already there. Frequent forgetfulness, difficulty thinking clearly, and that constant feeling of mental exhaustion. But there's a hidden side to these medications that no one talks about, and you need to know it right now. Because the sooner you understand what's happening inside your brain, the greater your chances of protecting yourself, and maybe even reversing some of the silent damage. A lot of people out there still believe that just because a medication is prescribed or sold at the pharmacy, it's completely safe. But the truth is far more uncomfortable. Some of the most common medications, like those for sleep, anxiety, or allergies, can directly affect the brain. They interfere with critical areas responsible for memory, focus, and decision-making. And the scariest part? These effects rarely come with a warning on the label. It's like slowly dimming the lights in your mind without even noticing. Take benzodiazepines, for example. They're among the most prescribed drugs in the world for anxiety and insomnia. But what hardly anyone talks about is that medications like diazepam or clonazepam reduce brain activity, trigger temporary amnesia, and double the risk of dementia in the long run. It's like using a silencer on your brain. Everything feels calmer, but inside, your cognitive function is shutting down. And in elderly people, the damage goes even deeper. Focus gone. Memory fading away. Another dangerous but less discussed group is anticholinergics. These are used to treat allergies, asthma, and urinary incontinence. But by blocking acetylcholine, a neurotransmitter essential for learning and memory, these medications create the perfect storm for Alzheimer's disease. People who use them frequently report trouble concentrating, brain fog, and even insomnia. The name might sound technical, but the effects are very real, and increasingly common in doctors' offices across the United States. And yes, even medications considered preventive, like statins, can be problematic. While they lower cholesterol, they also reduce the production of vital coenzymes for the brain. The result? Mental slowness, memory loss, and a fatigue that's hard to explain. And if you've made it this far, it means you care about your mental health. So here's what you should do. Like this video, subscribe to the channel, and drop a comment below if you or someone you know has ever used these medications. Your experience might just help someone else. And what's coming next is even more concerning. Now, if everyday medications already pose an invisible threat to the brain, imagine the drugs used to treat mental disorders, inflammatory diseases, or more delicate health conditions. The problem here is even more serious because many of these medications directly interfere with neurotransmitter production or the brain structure itself. No wonder more and more studies are linking these drugs to cognitive decline, memory loss, and even the development of dementia. Take tricyclic antidepressants, for example. They were once extremely popular in the United States, especially before the arrival of modern antidepressants. These drugs affect acetylcholine, damaging memory and slowing down thinking. It's that classic case where the person starts to feel less sad, but also feels their mind shutting off, forgetting simple things or struggling to focus at work or school. What was supposed to help the mind sometimes ends up limiting its function. And it doesn't stop there. Corticosteroids, widely used to treat inflammation, have a devastating effect when it comes to the hippocampus, the part of the brain that controls memory. Long-term use of these medications increases cortisol, reduces neurogenesis, which is the formation of new neurons, and disrupts emotional balance. Meanwhile, interferons, used in autoimmune diseases, can cause intense mental fatigue, slow reasoning, and depressive episodes. All of this slowly wears down mental clarity. And what about that super powerful antibiotic that many people take, believing it's the solution for everything? Fluoroquinolones. They can cause side effects that last for months or even years. Anxiety, insomnia, neuropathy, mental confusion. Symptoms that go far beyond just an upset stomach. And if all of this already has you concerned, wait until you see the next group of medications, because there are plenty more substances that, instead of healing, are quietly draining your brain's energy. Now it's time to talk about a group of medications that most people would never guess could harm their brain. They're sitting right there at your local pharmacy, in hospitals, and even in the offices of the best doctors in the United States. These are drugs used for issues like acid reflux, diabetes, high blood pressure, or anesthesia during surgeries. But behind a simple pill or in 4 dose, what's happening inside your mind could be far more alarming. Let's start with H2 blockers, commonly used to relieve acid reflux and heartburn. The problem: they reduce the absorption of vitamin B12, which is absolutely essential for keeping memory sharp. A deficiency in this vitamin is linked to mental confusion, depression, and cognitive difficulties. People who use these medications frequently often start feeling a kind of mental slowness they can't quite explain. And the worst part? It can take years before someone realizes that it all started with that little heartburn pill. Then there's metformin, extremely common in the treatment of type 2 diabetes. It also interferes with vitamin B12 absorption. The result? People taking this medication long-term may experience memory loss, mental fatigue, and an increased risk of developing dementia. Who would have thought that a drug for controlling blood sugar could have such a direct impact on the brain, right? That's why many people in the US are already monitoring their B12 levels while using metformin. But the risks don't stop there. Medications like calcium channel blockers, used to control blood pressure, can reduce cerebral blood flow. And when your brain gets less blood, it gets less oxygen and fewer nutrients. That's when the classic signs start showing up: weak memory, mental confusion, and even a higher risk of vascular dementia. And to top it all off, there are general anesthetics. Yes, that medication you receive before surgery can cause postoperative cognitive dysfunction, neuroinflammation, and accelerate Alzheimer's, especially in elderly patients. So tell me, after all this, is the pharmacy really only selling solutions? Or is it sometimes selling a problem disguised as quick relief? There's definitely something to think about. Because the most important part comes next: learning how to protect your mind from all of this, and, of course, how to turn knowledge into real action. Now tell me, after all this, are you really going to keep taking any medication without first questioning what it might be doing to your brain? Is it really worth relieving a symptom today if it means paying the price of memory loss, dementia, or even Alzheimer's tomorrow? The truth is, the knowledge you have now is something very few people know. And those who use it live better. So, what's your choice from now on? Will you keep making decisions in the dark? Or will you start giving your brain, your memory, and your future the attention they truly deserve? And speaking of protecting your mind, here's something even more surprising. Certain foods can either be your best friend or your worst enemy, and nuts are the perfect example of that. By the way, if you want to keep learning how to protect your body, your memory, and your health for real, there's a video here on this channel you absolutely need to watch. In it, I reveal what nobody tells you about nuts, the good ones and the dangerous ones. Trust me, after watching it, you'll never look at walnuts, almonds, or any other nuts the same way again. And hey, if this video helped you in any way, don't forget to be part of our community. Drop a comment down below sharing what surprised you the most, subscribe to the channel, and hit the notification bell. Because from now on, your health deserves your very best.